I'm Dr. Chris, the Detox Dentist, but more importantly, I just want to share with you guys what I actually mean with Detox Dentist and why I'm even doing this YouTube channel, which is honestly not as easy as I thought it would be, and it's taking a lot more time, but also feels like it's going to be very rewarding for me, but also for you guys. Now, I started this channel because I talk to patients every single day about their oral health and how it relates to their body. And every single patient, pretty much, is shocked with what I have to tell them and the things they learn, which to me is a failure of dentistry in general because this should not be a surprise. This should not be a huge, different type of exam than what they've had in the past. And it drives a few of them to tears, which is awkward but important because they're getting answers that they've never had before. And they've had dentistry for decades at times, and consequent illnesses and autoimmune diseases and mental health challenges that are clearly related to large problems in their mouth. And every single day I tell the same story. So, why do I call it the detox dentist? Well, it is a story of toxicity. That's what it is. And detoxing has been so overdone in this entire natural health field. It's ridiculous. It's embarrassing because when I talk to patients and they tell me they're spending hundreds and hundreds of dollars on this detox protocol or that detox protocol, or they're on the Lyme protocol, they're working with this doctor and that doctor, and these are all, very highly respected online professionals. And I look in their mouths and I see massive infections, which immediately tells me that none of those detox protocols that they are spending a ton of money on are doing anything. Honestly, you cannot detox with anything. I don't care if it's the golden miracle fulvic acid, whatever you want to call it. It doesn't work if you have a massive infection in your mouth. And unfortunately, the vast majority of people that I see do. Now, so I go through the exam. We do a 3D scan, a CBCT, that shows me every single tooth in 3D, the sinuses. It is the standard of care, yet most dentists still don't do this. And you cannot see infections unless you actually have this 3D scan. So I do the 3D scan. I go through a very thorough exam, just like every dentist probably should. Tooth by tooth analysis. I do a TMJ check. I do oral cancer screening. I do function checks. The periodontal checks, things that we just have to do as a new patient exam. And then I go through the records with the patient. We go through the x-rays because I feel you need to know what I'm looking at. And I tell the patients, this is not rocket science. This is not difficult. Yeah, I've done it for, some odd 30 years, but you can understand your x-rays. You can see an infection. And if you can see it, then the other dentist should have seen it, right? And frequently this has been an infection that's been there for many, many years. Many years. Old root canals that didn't work out, dead teeth, cavitations, FDOJs, bone infections. When they take out a tooth and they leave, they don't really clean it out correctly, or you were under severe stress and you didn't heal correctly. One of those reasons that you have a lesion in your bone that didn't heal, and that shows up on the right x-ray. These are things that your body cannot heal on its own. These are toxins that are loaded in the bone, in the teeth, in the gums. And guess what? They don't stay in the mouth, right? I think I talked about that in the last video. It's so frustrating. They move all over the body. They go to your heart, your lungs, your brain. They go to your nerves. They go to the fat. They get stored in the fat around the nerves. They go to the baby. They cross a placenta. They cross the blood-brain barrier, like we just said. They go everywhere. They've been found everywhere. So it's a mouth to body connection. I feel disease really starts in the mouth. And if we don't detox this oral cavity, then whatever you are doing to detox your body, to get more energy, to get more mental clarity, to have the ability to, do what you need to do in life, to build that business, to spend time with your kids, to be a better husband, to be a better wife, to go hiking, those things require for your body to work, okay? And your body is not working if you're full of toxicity, and you are if you have an infection in your mouth. So I focus on those things with my patients. Those are the root causes of your illnesses. And why this is a shock to people, I don't understand. It shouldn't be. They should have heard this from every dentist in the past. Every medical doctor, every naturopath should have discussed this with them in great detail. But they don't. They don't. And so when they finally come to see me and I do the exam, I go through everything, I tell them pretty clearly, we're going to work from urgent to important to optional. And often they've only heard important or optional. They've never heard urgent. They never heard the root cause approach for their mouth. So the detox dentist, I simply look at your mouth and I remove the things that inhibit you from being able to do all the other things you're doing to get better. The reason you can't lose weight, the reason you can't focus, the reason you can't sleep, the reason you can't exercise, the reason you can't do all those things that you want to do with your life that are absolutely critical. Living your life instead of just surviving. It is a frustration, a massive frustration for me. I speak about it, I write about it. Before this on Instagram, on conversations with patients at health fairs. I've shared this message with everybody, but I feel YouTube might be another great resource to do the same exact thing and help you guys find the root causes. So there are many sources of toxins in your body. It's not just the mouth, but if we don't fix the mouth, the other things we do to give you that super strong boost of health do not work. I mean, there's toxins in the air, in the water, in your food, mental toxins, EMF, attitude. Those are the things I like to focus on. But if I don't remove those infections in your mouth, none of those will work. The book I wrote, Hazmat Human, which is not quite out yet, but it will be soon, goes step by step on how to remove all these toxins after you saw the biologic dentist, to just literally reboot your entire system, rebuild your mitochondria, give you that energy that you were looking for so you can do the things you want to do in life, right? I really feel that the approach to detoxing the body from the mouth first is how we achieve optimal health. So I do this with my patients. I do it through my company, Boss Oral Health. I do it through fixing your biome. I do it through fixing your mindset. I wrote a book called Unbox Yourself that teaches you how to figure out what you really want out of life and how to get it. All those things are just parts of the puzzle to give you the ability to live life on your terms. It's telling you how to get to the point where you don't have to worry about your health, where you don't have to focus on trying to stay alive. We don't have to figure out what pill you have to take to have more energy, how to fix your blood pressure, how to lose weight. All those things should be natural. You should be a normal, functioning, healthy human. And then you should be able to do the things you want. Now, that is my purpose. My purpose is to give you back your life, to give you back the choice to pursue what you want to choose to pursue without limitations. That's the detox dentist. That's the detox pathway to get you to being able to live a normal life. It's really not that complicated, but it is overlooked all the time. And if we don't follow this pathway, you're going to be stuck in the sick care system forever. You're going to eventually develop significant autoimmune diseases. You're going to see a doctor who's going to prescribe you medications to treat you forever for something they're going to label you with that is really just an outcome of a root cause that they are ignoring. So If that's where you want to end up, please ignore this video, go out there and continue to do what you're doing. If you want to escape this rat race of toxicity, then follow me on this channel. Like this video so I know that you're interested in this kind of content. Subscribe and click the notifications. I'm learning how to do lives as well, where I can do Q&As for you on specific topics. And as you guys know, this is educational. This is not medical advice. I would have to have you come see me in the practice or some form of telemedicine. Can't do that over YouTube if we want to have a channel. So consider this just education. And if you want to take it to the next step, there will be offers that I have for you to work with me on this. Not one-on-one, because I don't have that kind of time anymore. It's going to be more on a mastermind setting where we work together to try to build your health. So that is the Detox Dentist. That's what I do. This is my purpose on YouTube, is to give you back your life.